Good morning, good afternoon, good evening all. A very warm welcome on behalf of the IPB events team. We are very much looking forward to supporting you with today's Advocacy to Action webinar, Beyond Eyes. I'm now delighted to hand over to Jess to welcome you to the webinar. Thank you.
Thank you, Debs, and welcome everyone to our third session of Advocacy to Action. For those of you who are joining for the first time today, this six-part series aims to inspire and support eye health advocates around the world to make the case for universal access to eye health. And as ever with Advocacy to Action, we're going to try and make it as interactive as possible within the confines of Zoom. So we're going to be using Slido, and I would encourage all of you to say hello to one another on the chat and post your thoughts throughout the session. So can I ask our team to run our first poll? And I'd like to ask everybody to say where they're joining from today. That's great. I can see lots of people posting in the Slido and lots of people posting where they're joining from in the chat as well. And it's great to see so many places across the world represented today. It's a reminder that eye health is truly a global issue with global advocates. So this is a particularly exciting time to hold our third session. Last week, we saw the adoption of two ambitious global targets for eye health at the 74th World Health Assembly. If we could just bring up the slides. So as part of these global targets, all countries have committed to a 40% increase in their effective coverage of refractive error and a 30% increase in their effective coverage of cataract surgery. The targets address the two leading causes of vision impairment, which account for 80% of the unmet need in eye care. It's a great moment for eye health advocacy. IPB and its members worked towards getting the World Health Assembly resolution adopted last year. And since then, we have been campaigning for the targets agreed last week. And I would like to thank and congratulate all IPB members who have been part of this global advocacy effort. We now have a mechanism to monitor global progress on eye health and to hold governments to account. The targets also provide a vital link between eye health and universal health coverage. It's a reminder that eye health needs to be considered as part of bigger global objectives. The World Health Organization's World Report on Vision and the Lancet Global Health Commission make it clear that eye health can no longer be viewed in isolation. We need to look beyond eyes. This is why in this session, we're going to be discussing the Sustainable Development Goals and what this means for our advocacy for eye health. Thanks to the Lancet, there is now indisputable evidence that eye health helps reduce poverty, improves educational outcomes, creates better employment prospects, increases work productivity, and promotes greater gender equity. But the direct link between eye health and over half of the goals needs to be more widely recognised by governments and decision makers. And we need to use it as a policy lever in our advocacy. We are now well on our way to having eye health formally recognised as critical to the Sustainable Development Goals. As we meet today, UN member states are in the final stages of negotiating the first United Nations General Assembly resolution on eye health. This will create a significant momentum shift in raising awareness, understanding, and commitment to eye health as a key social, economic, and development issue. A few key highlights of what's included in the resolution. Its main call to action is for countries and the international community to work together to reach the 1.1 billion people without access to eye care services as part of their efforts to achieve the SDGs. Eye health will be embedded in the UN and SDG framework. The UN resolution calls on countries to report on eye health as part of their reporting on the SDGs. It asks the UN to consider incorporating the global targets, which were just adopted, as possible indicators for the SDGs. And it asks the UN Secretary General to coordinate and follow up on the implementation of the resolution. From a country perspective, it encouraged governments to adopt a whole of government approach, building partnerships across government and with civil society and the private sector. It also asks international aid agencies and financial institutions to increase funding on eye health and the UN institutions like UNICEF, UNDP, UN Women, and others to incorporate eye health in their work. All of this means that eye health will be finally recognised as a global development issue. The resolution is expected to be placed under silence procedure any day now and will hopefully be debated on the General Assembly floor, with adoption expected in the next month. This will be a landmark resolution made possible by collective advocacy efforts. And we're going to be discussing what all of this means in our panel discussion later today. So before we get started and check everyone's still with us, we're going to run our next poll. So can I ask our team to bring that up? And can I ask everyone to write what the SDGs mean to you? Lots of really great things being posted. And I always think it's wonderful how wherever you are in the world, and particularly given the year that we've had, the SDGs always evoke so much hope and optimism, which I think is reflected in all of these words that are seen here. So I'm now delighted to introduce our first speaker, Kate Norgrove, who is the Executive Director of Advocacy and Campaigns at WWF, the Worldwide Fund for Nature. Kate has spent the last 20 years working as a campaigner on many issues ranging from international arms control to European Union policy, with clients such as Amnesty International to the Gates Foundation. She previously worked as Global Head of Campaigns at WaterAid, where she led efforts to get a Sustainable Development Goal agreed on water and sanitation. So Kate, if anyone can share some lessons learned on advocacy approaches and framing issues in the context of sustainable development, it's you. Thank you so much for joining us today. Over to you.
Thank you so much, Jess, and it's an absolute pleasure to be here. I'm really looking forward to the panel because whilst I can help as much as I can from my position at a global organisation doing global advocacy and campaigning, actually the real work is in the implementation in countries. So I'm really looking forward to talking to many of you and learning from many of you about that. So Jess asked me to talk a little bit about how to integrate eye health as a development issue, or how to draw on my experience, as she said, from WaterAid in how best to do that. And I just thought I'd talk you through a little bit of a story. So I'm going to give you a bit of context as to what life was like at WaterAid when we first started on this in 2008, 2009. I'm then going to talk a little bit about the process of development, the way that we managed the campaign and what we achieved, and then a little bit about impact, how we actually got it delivered on the ground, or question really how we got it delivered on the ground, because that's the work that is still being done now. So in terms of the process, or the context rather, to start with, so sanitation, water and sanitation, and this is in WaterAid's context, this means the provision of clean, affordable water to everyone, everywhere by 2030, and sanitation and hygiene. So sanitation being access to toilets and safe toilets and systems, sewage systems, so that people could have a hygienic and clean lifestyle, and then hygiene, which is availability to water and sanitation so that you can wash your hands, clean your face, which I know is critical for eye health. All of those things, in particular sanitation and hygiene, were an afterthought in the Millennium Development Goals. So in 2001, 2002, sanitation was put in as an afterthought target in the Millennium Development Goals. Water, I think, was one of the subsets of one of the goals rather than being a goal in itself. By 2015, though, after we'd done this advocacy over a long period of time, we then had a whole goal dedicated to the water and sanitation and hygiene, which is goal 6. Some really decent targets. Of course, you're never totally happy, but as much as you can be happy. And there was a separate target for sanitation as opposed to water, which was something we really argued for. Often the two are conflated into one, but they're actually, the actions around them are quite importantly different. And then we managed to get some targets integrated into the other goals. So in particular in education, where there were or there are rather, targets for having separate water and sanitation facilities for boys and girls, for example. We totally failed in integrating water and sanitation into the health goal, and I can talk a little bit more about lessons around that in a minute. So I would say, as WaterAid, but the sector as a whole, started work on this really in 2010, 2011, so 4 or 5 years before the goals, the Sustainable Development Goals were delivered in 2015. And we started it all with a really good plan. And it sounds obvious, but having an objective that said we're going to have a goal for water and sanitation, rather than be only integrated into the other goals, it's not easy to get sectoral agreement around what the actual, what the goal was. And then the ways that we were going to try and achieve that were varied wherever you sat, wherever you were. But we kept updating that plan, and we had an extremely good process, I would say, of monitoring whether we were achieving it or not, which helps us to learn. So getting together with our partners, as you are now doing, and with our offices as WaterAid, to say, okay, well, what am I doing? How am I doing on achieving this plan? When we look back in the evaluation, sort of 5 years after we started, the most important thing that we discovered, and we got some external evaluators to help us with this, is that unlike many other sectors, we had extremely good cohesion across the sector. So we developed right at the very beginning a common agenda for negotiation in a 12-page set of policy documents. And that really helped align the whole water and sanitation sector together around this policy document. And there were 2 or 3 organisations that led this. WaterAid were not the only one. There was the Water and Sanitation Collaborative Council and the JMP, which is a group of agencies involved and responsible for monitoring water and sanitation around the world. We did really, really good capital level advocacy. So identifying at the centre, if you like, which countries were going to be core and key for getting this Sustainable Development Goal over the line, and then working with partners and countries all over the world to get that done. So through insider lobbying in India, in Kenya, in South Africa, in Nigeria, in some of the key capitals in Asia, in Delhi, and working with people who had really good insider access to do that lobbying. We also, as WaterAid, set up a coalition called the End Water Poverty Coalition, which was a campaigning coalition of organisations working around the world on, particularly on World Water Day, where there would be a great big walk for water. And that, I think, still is in existence, and really to demonstrate the length and the distance that people have to go to collect water in their daily lives. And that was a fantastic, it ended up being a week, but it was a fantastic way of mobilising the sector every year. We had really, really good allies in the UN. We had a big ally in the Deputy Secretary General, Jan Eliasson, who used to be chair of WaterAid Sweden. And he knew and spoke brilliantly about the need for water and sanitation to be taken into account and taken into account as a development issue. We had Ellen Johnson Sirleaf, who is was the president of Liberia at the point that we were running this campaign, and she did breakfast events with us in the UN and op-eds, opinion editorials in key newspapers. I remember one particular moment before a key vote of the Open Working Group, which was the process by which all of the goals were negotiated by various member states. We managed to get an opinion editorial into the New York Times, or maybe it was the Washington Post, just before that happened, that took place, so that was fantastic. We got very involved in regional negotiating forums. So the African Union, for example, the annual meetings, biannual meetings, meetings of water and sanitation ministers at the Africa level, and finance ministers as well, which is the other key thing, not to forget that actually finance ministries drive a lot of decisions on spending and prioritisation. So it's not enough just to get to the water and sanitation ministry or even the health ministry. You need to get to the place because money talks, unfortunately. We had some amazing popular tactics. So at some point I dressed up as a poo, and we had these incredible costumes that we wore, and I went around New York dressed as this poo, and we had a poo on the loose that some of the UN negotiators had to find. It was a brilliant game. Sometimes it's just doing funny things that get to people when they're in the middle of boring UN negotiations works quite well. I remember in a previous job when I was working on the Arms Trade Treaty, we put together a kit. So like, you know, what are they called? The things that children throw, like a paper aeroplane. So we had a kit of paper aeroplane demonstrating how many different bits of this paper aeroplane were brought in from around the world to make a potentially dangerous aeroplane. And we delivered to all of the negotiators in the UN, and they loved it because it was just something to do in the middle of these deathly dull days in the basement of UN negotiations. We did a photo series around what you take in your maternity bag on the way to hospital, making the point that in lots of countries, you don't have to think about taking water with you. We negotiated and connected water and sanitation to the antimicrobial resistance movement that was really gaining traction in WHO, because without water and sanitation, antimicrobial resistance gets worse. We did campaigning, as you were talking about, in the World Health Assembly, and we ran campaigns since then, or we have ran campaigns since then with midwives, nurses and doctors on the availability of water and sanitation in doctors' surgeries and in hospitals. There was some fantastic in-country campaigning as well. So I remember in Mali, the Mali team took a bunch of doctors and parliamentarians, to visit healthcare clinics where there was no water and sanitation, and those parliamentarians got a real shock when they could see on the ground actually what was happening with lack of water and sanitation in hospitals. In Madagascar, they launched a report called the Court Short Report, and in many countries, so for example in India, there was some fantastic state level campaigning and advocacy work that went on. Just finally, to talk a little bit about impact, because I think it's one thing getting an amazing resolution at the UN and getting the SDGs into place with a standalone goal on water and sanitation. But actually the difficult bit is how to actually get it working in practice. And for that means engaging with all forms of power, vested interests, systems that can help and hinder you in implementing that. And I came away from WaterAid thinking that really I should be working on a campaign for more and better civil servants rather. I remember quite soon, not long before I left WaterAid, going on a visit to India and meeting a guy that was responsible for water and sanitation for a huge area of Karnataka, I think it was. And he had absolutely no computer, no IT, no way of monitoring and tracking the implementation of these human rights. And that was very shocking. So it's actually the systems of government that need to work effectively to be able to deliver these human rights. And you can see that even more this year with the impact of COVID-19. Community health workers are so key, which means that we all need to work around things like women's rights and the way women are treated, because women are often community health workers. Financing is obviously absolutely crucial, and I would emphasise that working with the finance ministry to get the right priorities and the right money in the right place. And more practically, from an international NGO perspective, I have reflected more and more how important it is to get resources away from the centre and towards countries where they are campaigning and advocating on the tough, hard, gritty work of getting policy, global policy, implemented into national policy, and then state level and regional policy, and then actually getting that implemented on the ground in practice. That's where our resources really need to go to make things happen. So Jess, that's me, and look forward to the panel.
Thank you so much, Kate. I think there's an enormous amount that we and the eye care sector can take from that. Obviously, eye health wasn't included in the SDGs or within any of its targets or indicators, and we're trying now very hard to correct that and demonstrate the links that eye health has across the SDGs. And some of the approaches and activations that you did, I think, provide a very good roadmap and plan for us coming together as a sector and taking that forward. And I just love the idea of a poo running around New York. I'm sure that would have lifted lots of spirits in the depths of negotiations. So I think that sets us up perfectly now for our panel discussion. And we have such an impressive panel with us. I'm sure my introductions will do none of them justice, but I will try. And I would encourage everyone to go away actually and look at their full biographies on the website, because we have a very impressive group of people. So we have with us, and I'll start with Dr. Jane Barrett, who's the Secretary General of the International Federation on Aging. Jane is a great friend of the eye care sector, and I'm never sure when Jane has any time to sleep, probably because we get her up very early in the morning for these types of sessions. And if I were to read all of Jane's various kind of positions and appointments, I think I would need a rest. So Jane, it's great to have you with us today. Thank you for coming.
And thanks, Jessica. It's a real honour to be part of this important session. So thank you very much for the invitation.
Great. And next we have Labrini Papagiorgio, who leads Roche's global policy strategies on vision, health, rare diseases and gene therapies. Roche joined IPB, I think, almost a year ago now, and in that time has made an enormous contribution and provided great thought leadership to the sector, which has been made possible by Labrini's endless energy and enthusiasm. So thank you, Labrini, for joining us.
Thank you, Jess. Really excited to be here with all of you today. This is a momentous time in the history of eye health advocacy, and congrats to everybody that worked tirelessly pushing this forward.
Thank you. And next we have Dr. Imran Khan, who I'm sure will be known to many of you in the audience. Imran is the Director of Programme Strategy and Development at Sightsavers and has over 20 years of experience in international development, academia and clinical work. And he also serves as co-chair of the IPB Climate Action Working Group, which has just announced its new call to action. So I'm sure we'll hear a little bit about that in a moment. Imran, great to have you with us.
It's a pleasure to be here, and really look forward to the panel and engaging with all of you for this exciting work.
Great. And then finally, we have Dr. Stanley Berberi from the Ministry of Health in Uganda. Stanley has done an enormous amount for school eye health, bringing on board his counterparts at the Ministry of Education, not only through advocacy, but also through national programming. So Stanley, thank you for joining us. You're on mute, Stanley. We'll try and unmute you. Oh, there we go.
Can you hear me?
We can.
Yeah, thank you very much. It is always my pleasure to share our experiences with the rest of the world, experts like what I see on the panel, and I think every day is a learning exercise. Thank you very much.
Thank you, Stanley. And of course, we have Kate as well, who's joining us. So Imran, I wonder if we could start with you actually, because part of integrating the SDGs into our work means that we need to think about ways that eye health can contribute and help accelerate efforts to achieving the SDGs. And I know that the Climate Action Working Group has thought a lot about this. Can you tell us a little bit about what the Climate Action Working Group has been up to and what the SDGs mean to you?
Sure. Thanks, Jessica. So, well, we know that climate change is having a devastating impact on all parts of the world. And specifically, when we focus on eye health, we know that due to climate change, we have an increased incidence of a number of blinding conditions, including trachoma, cataract, vitamin A deficiency, glaucoma, macular degeneration, to name a few. But at the same time, as we have the rising incidence of these conditions, we also know that climate change affects the ability of health systems to then respond to these adverse climate effects by directly impacting both service delivery as well as supply chains. So definitely a critical issue when we consider the impact of environment on eye care. But at the same time, we know that all healthcare does contribute to greenhouse gas emissions. So healthcare contributes about 4.4% to the total greenhouse gas emissions, and this includes eye health. So we need to also consider the effect that our service delivery has on the environment. So the Climate Action Working Group was an initiative started through IPB in 2017 to really look at how we can spearhead action to both mitigate as well as adapt to the effects of climate change on the eye health sector. So as you had mentioned, we have just released our guide as well as a call to action, which provides resources for organizations to help them on their journey towards environmental sustainability.
Thanks, Imran. And that's really great to have that information available to the sector. And I think the wonderful thing about the SDGs is it forces us to think beyond our issue and how our issue touches on other issues. Certainly when I think about the SDGs, I think about the partnerships that we can make. And Jane, if I can come to you, because obviously the eye health and the aging community have built a great partnership thanks to you over the last few years. And I think there is now more opportunity for us to work together, particularly with the UN resolution on eye health. And I know that UN has also just announced the decade of healthy aging. I wonder if you could just tell us a little bit more about the decade, what it means and what opportunities there are for eye health and aging to come together.
And thank you, Jessica. It's a really important conversation. I think just building from Kate and Imran, you know, I think one of the things that I want and need to say is that we don't often talk about the word eye health. We actually see eye health in the context of someone's function. And I think it's really important to have narratives that actually connect, because the way that we advocate is quite similar, but it's these connecting words that are going to actually help us not only empower individuals, but also to be successful in advocacy. So you talked about the UN Decade. The UN Decade of Healthy Aging was launched not so long ago. And what is it? You know, it is the opportunity over a 10-year period to globally collaborate. And it is aligned with the last 10 years of the SDGs, and it brings together government, civil society, international agencies, professionals, academia and media, all those agencies and stakeholders that we think need to be singing from the same song sheet to influence and shape policy. You know, what's important when we talk about eye health is that we look at it through the lens of 4 action areas of the decade: ageism, long-term care, primary integrated care, and age-friendly cities and communities. And, you know, these action areas are enabled through voice and engagement, the voices of older people. And Imran mentioned gender, you know, the feminisation of ageing. So what I'm trying to share with you is that both what Kate talked about and Imran talked about, you know, there are interconnecting pieces, and it's about what is the collective narrative that we can use so that there is power in numbers and there is a unique power in actually helping governments to understand the intersectionality of eye health, vision, climate change, water. So there is a connection. And this is, I think, one of the most important roles of civil society going forward. And one last thing, and that is that the Global Report on Ageism was launched this year. And it's not only, you know, older people and ageism, it's younger people and ageism. And we also know that people who are positive about growing older, you know, they live 7.5 years longer. So I'll leave it there, but thank you for the question.
Thank you, Jane. And I think that point about narrative and coming together to build that narrative, but also to collaborate is really important. Labrini, can I bring you in here, because the Vision Scorecard, which you helped work on, is another great example of where eye health and aging in particular have come together in a kind of meaningful way to build that narrative and to put that to governments and decision makers. So what's your advice on building that narrative and that cross-sector partnership?
Thank you, Jess. I would like to second what Jane just said about combining mega policy trends in order to make more powerful statements on the case to act urgently. In that spirit, having cross-sector partnerships, especially with the angle of healthy aging, is really facilitating what we're trying to achieve in the effort to bring to the communities what they need. Specifically about the Vision Health Scorecard that the Global Coalition on Aging developed in close partnership with Jane and IAPB and others who are influential within the space, is quite important to understand that when we're combining these two aspects and synthesize the policy asks, this really makes the case to governments and policymakers to act. And that kind of reinforces joint advocacy, and it benefits all communities. So by finding that connection and really fostering those partnerships, you're able to achieve much more and deliver to the communities, the patients, individuals, and societies, the growth and prosperity they deserve.
Thank you, Labrini. And it's really great to have the scorecard. It's a wonderful resource for both the eye care sector and the aging community. Stanley, can I bring you in, because actually we're talking about partnerships, but this needs to happen not just at a global level, but also at a national level as well. And I wonder if there is what you can share from Uganda's experience that other countries can learn from, particularly your experience of building that cross-governmental partnership and reaching out, for example, to the Ministry of Education.
Thank you very much, Jessica. And I'd like to share with the panel and any other viewers that Uganda has an administration that is centralized. So what I'm going to talk about is that we have got to do some activities and lay strategies and interventions at the national level, but also at the district level. And I'd like to say that these partnerships don't simply come, but they actually have got to be planned for. And the Ugandan example the examples I want to share with you at the national level, which are replicated, not all some, but a good number of them as follows. First of all, we have got the National Development Plan, which guides the planning for all sectors. And Uganda is now developed the third development plan. But the experiences we have had, which I'm sharing with you, were best all informed by the National Development Plan too. And all sectors contribute to that plan. So that is very important. It has been our guide. Now this year we have started the National Development 3, which will guide our future planning. Now, we also have the National Strategic Plan, and the National Strategic Plan includes eye health, among other things. And it also gives us a guide. But I also would like to say that as we go further, then we have program-specific plans. And we have been implementing our fourth eye health strategic plan, 2016-2020. And 2021 now we are developing, we are in advanced stages of developing our fifth eye health strategic plan. And in this strategic plan, pattern and the National Health and Development Plan and the National Development Plan, all of them talk about partnerships, networking, resource mobilization, among others. So that is very important. And I also want to say that we have other specific plans. For example, in Uganda, sometime back, we developed a national intervention on uncorrected refractive errors strategic plan. And a lot of school health, networking with schools was emphasized in that plan. And all these have been useful in steering our partnerships because we have the documents that we can share with our partners. And it is not only sharing, but really making sure they understand them. And when we go to our national partners, we have those plans that we share. We go to the districts, we share with the district leaderships. And I also want to say that the other intervention that we have been having is regular supervision. We have got to interact with the regional and district leaders, both professionals and administrators. And we have also been evaluating both all those strategic plans, midterm and end evaluation. And you know, when you evaluate, you are actually get information that helps you to plan better. So that has been very helpful. But I also would like to say that our national strategic plan for eye health puts in place what we call the National Committee for Prevention of Blindness. And allow me to share with you the membership of this plan, and you'll see how the network comes. The Ministry of Health is the secretariat, and I have been the coordinator for quite a number of years for that national committee. But it is chaired by our permanent secretary and sometimes the Director General of Health Services. Me, I'm just the coordinator and the secretary. But we have other ministries, notably Ministry of Education and Sports, Ministry of Gender, Labor and Social Development, for obvious reasons. Because most of the children can be found in schools. So if you want to reach most of the population very easily, then you go through schools. You can't go to schools without collaborating with the Ministry of Education, both at the national levels and the district levels. And we have been doing this very well, and the counterparts understand. But there are also some youth who are out of school. We are able to get to them through the community development officers who fall under the Ministry of Gender, Labor and Social Development. So at the national level, my counterpart commissioners are also members of this National Committee for Prevention of Blindness. Then representatives of disabled people's organizations for advocacy purposes, and the Uganda National Association of the Blind is a member of our committee. Then we have got NGOs, both local for eye health and international. For example, we have got Sight Savers, Light for the World, and before it closed its offices, Brian Holden Vision Institute, and then we have CBM. All those NGOs are members of the committee. The professional associations for ophthalmologists in Uganda, ophthalmic clinical officers in Uganda, optometrists in Uganda, because these are experts in their areas. Then regional ophthalmologists. We have got 17 regional hospitals, and all these are members of the committee to represent their regions. Then we have got one representative from the district health officers, and then one member of parliament. Preferably, we prefer one member who is blind. So that is one way of reaching parliament, and that has been very helpful. And that takes me to an advocacy strategy. 2016, we developed what we call a collaborative advocacy strategy for eye health in 2016. And our slogan was Uganda free from eye problems. And I want to say that this strategy was developed through the leadership of Ministry of Health, but with a lot of support, both financial and expertise from our partners, including Light for the World Sight Savers and Brian Holden Vision Institute by them. And this strategy has helped us to infiltrate further down, both not only at the national, but at district levels. You'll find an administrative leader of a district who does not know much about eye care, but this advocacy strategy has helped us. And I believe that the other countries can actually borrow that leaf and have advocacy strategies. And in our advocacy strategy, we have issues which are purely for health, others which are for Ministry of Education, others which are for Ministry of Gender. The main ministry is dealing with eye health and disability in general, but we also have a category called cross-cutting issues. These cross-cutting issues apply to all of us. We have used that approach to increase the profile of eye health. And I want also, yes.
Sorry, Stanley. I was going to say that is an absolutely fantastic model that I think, you know, all countries should be striving for. I mean, it's wonderful to see actually what an integrated approach you have to eye health at the country level, and also to go back to Kate's point that, you know, these things don't just happen, that you need to put a plan and a strategy in place to make it happen and to build those cross-sector partnerships. And I think we'll come back to you just on your strategies and how you've taken that forward. But before we do, Kate, I wonder if we could come to you, because we saw from our poll that we did at the beginning that when people think about the SDGs, they think about big global ambitions, you know, progress, prosperity, equity, but it can be sometimes quite hard for organizations to then think about what that actually means for their sort of day-to-day work, you know, how they integrate the SDGs into their advocacy, into their programming, and how they connect to the bigger picture. So what advice would you give to those organizations?
Well, I think actually Dr. Stanley in a way has just shown us how to do it. I think integrating your approach at the national level with the national planning commissions, for example, and I believe, you know, they're called different things in different places, but the commissions that decide, okay, here are the global SDGs, what does that mean in our context, both at national level and at district and state level, and how will we put those into action? Engaging with those as early as possible and throughout the process of implementing those plans is the most important way of translating the SDGs into your own context. I think there's a risk that they all become very technocratic, and that actually, you know, you can have lots of plans and lots of commissions and lots of coordination, but then actually very little money and leadership then trickles down into the places where the implementation actually needs to happen. And I think that's my biggest fear. And I think some of that can be overcome by having civil society, local civil society, really embedded in the process of commissioning and implementing national level and district and state level plans. And then this other thing is the finance side of things. So, you know, so we've got this plan, how are we going to finance it? And I think although 130, 140 countries have developed these national action plans of translating the SDGs into practice, very few have decent funding behind them. And that's where, you know, everything falls down. And the challenge there is for the SDGs to become part of the delivery and accountability of a government, and where things get very political. And in a context like context in Uganda even, or in many other contexts, getting involved in a political discussion at national level and at district and state levels is really tough. So our advocates and campaigners at those levels will have lots of challenges, and we need to protect and support them as much as possible.
Thank you, Kate. And Imran, can I bring you in here? Because obviously, as well as your IAPB hat, you're also Director of Programme Strategy at Sightsavers. And I wonder if you could share your thoughts from the civil society perspective about how you integrate the SDGs into the work that you do, particularly at a country level.
Sure, and I think just building on something that Dr. Stanley said is around how you frame the different issues. So I think it's really interesting when we look at an issue like school eye health and framing it not as a health, well, not as an eye health issue or not even as a health issue, but really looking at it as an education issue, looking at, you know, a pair of glasses for a child in a school as a necessary piece of equipment, so as much as a blackboard or pencil, for example. So I guess it's really looking at the holistic view. So taking things out of a eye health box and looking at it in terms of an education box, or, you know, a water and sanitation box, or an aging box, or an environment climate change box. So that's really how Sightsavers approaches these issues by really looking at the integration of how eye health touches on different development issues. Because as we know, poor vision is a cause and consequence of several development issues. So understanding that integration and really building off that is one way to achieve success. And also, yeah, as all the panelists had mentioned, the importance of collaboration and partnership, because as we go in only within eye health, you know, that's a fairly limited group, but we have a much greater collective voice when we are integrating the eye health issues with these other development issues.
Thank you, Imran. That's a very good point, and it all comes back to this point around kind of the framing of eye health and really linking it to these other issues. Jane, if I could bring you back in and to have your thoughts on this and really how we kind of broaden our advocacy and campaigning on eyes to think beyond eyes and thinking about the lessons you've learned from the ageing sector.
Sure. Look, this is a really fascinating discussion. I think one thing that I need to say is that eye health is not only a development issue. You know, we live in globally, and I get sometimes concerned that we're carving up the world, you know, in the way that we're speaking. So if I think, you know, to SDGs and COVID, for example, you know, no government will avoid the impact of COVID. And when it comes to eye health, whether it's in New Zealand, Australia, Brazil, you know, no government will avoid the impact. But where does an older person with vision impairment fit into a conversation when there is so little money left from looking at the life course approach to eye health? So there's lots of competing, you know, groups that we need to actually bring together, because what we haven't talked about is that civil society is not well funded. You know, so we're asking more and more of civil society to step up and be part of this campaign and join. And yet, you know, income security could be the only area that an organisation, you know, can focus on. So it really is behest to us to reach out and to make the connections. You know, education is great. You know, how do grandparents advocate for eye health in schools? So it's about this cross-generational cohesion that we really need to start creating.
Thank you, Jane. I wonder if we could just spend a little bit of time just touching on the UN resolution, which will hopefully come next month, fingers and toes crossed. And Labrini, can I turn to you and just get your thoughts on what you think this will mean for the sector and our advocacy?
Yeah, sure. So the resolution is a strong political message, basically recognizing the need to urgently act for individuals living with vision impairment, and it would help elevate vision health at the top of the policy agendas. It would renew the momentum, it would be a springboard for action, and it would showcase how we can actually, through the actions of eye health to reduce vision impairment, have indirect and direct benefit to the SDGs. So you could really reframe it as a sustainable development priority. And from a top-down perspective, from the UN incorporating into the work, or from a bottoms-up perspective, having countries with frameworks and action plans, I think we're moving from the advocacy era to the action mode. And that is really fascinating for the sector.
Thank you, Labrini. And in that vein of moving from advocacy to action mode, Dr. Stanley, if I could come back to you. I mean, do you think something like the UN resolution is going to make a difference to the work that you're doing, and how will that impact sort of taking that forward and national implementation?
Thank you very much for that question. Of course, I'm very excited that yet another resolution on eye health is coming up, because quite often our leaders, our governments listen to big voices. And I think, you know, there is no voice that is bigger than a UN resolution. So you realize that the Sustainable development goals have gone a long way to put disability, eye health inclusive on the agenda. The first time there was something similar to that, we were completely missing. But now we realize that we are being understood better, and it is easier to advocate for eye health. And therefore, with the resolution to come, like my fellow panelist has put it, if it is well mentioned, well put, well framed, I think she used the word framing it properly, then why not? Then, and remember, it is the top leaders of our countries who are attending such meetings. So if they commit themselves at UN level, then we find it much easier at country level. And even when we go down to regional and district levels, and we are quoting a UN resolution to which our leaders have appended their signatures, then we see a good development and progress for eye health. That's my feeling.
Thank you, Dr. Stanley. And I'm conscious that we're running almost to the end of our session, which I can't quite believe, because it just feels like we're getting into the meat of our discussion and we could probably talk about it for the rest of the day. But something that I would like to ask from each of our panelists, and it's something that we did actually in our first Advocacy to Action session, is we asked everyone to give their elevator pitch for eye health. And actually we had some really great statements from our last speakers, and I've taken now to just writing them all down, and I think they'll make a great key advocacy messages document at some point. So the task is that you're stuck in an elevator and you have one or two sentences to convince, whether it's the Prime Minister or the Minister of Health or the President of your country, to really invest in eye health. While I give my panelists a couple of minutes to think of their one or two sentences, we're just going to run our last poll, and I'm going to ask everyone to use the chat function if they can. So can I just ask everyone to start typing in the chat what your main takeaway is from today's session, and we'll just keep a note of those coming in. So I am going to pick on Imran first, your elevator pitch.
Thanks, Jessica. Yeah, I mean, I would just kind of echo something that I had already mentioned around poor vision being a cause and consequence of several issues. It touches on every part of our lives and every part of our of development. So in order to achieve progress towards the SDGs, we have to ensure that we do invest in eye health and we do prioritize eye health.
Thank you, Imran. And if we could come to Dr. Stanley, you're already in the government, but perhaps you're convincing your boss to do more.
Thank you much. My simple message would be, eye health is for everyone. It is everybody's business, and it affects productivity. So we need to invest heavily into eye health in order to promote development.
Perfect. Thank you, Dr. Stanley. Labrini.
Vision impairment hinders human potential, exacerbates inequalities. It poses devastating consequences for individuals, societies, and economies. It will continue to get worse unless we act urgently and work together towards making it an investment priority, as it is essential for SDGs achievement.
Thank you, Labrini. And Jane.
Investment in prevention, access, and equity gives rise to equalities across all ages. And Prime Minister, this not only saves eyesight, but it also saves lives and promotes the social and economic contributions of each and every one of your citizens.
Thank you, Jane. And Kate, I feel it's a bit mean because we've had a 1-hour introduction to eye health, but if there are any words that you could share listening to what you've heard today, what would they be?
I would say, Prime Minister, my son is at school. and spent the last 2 months not being able to see, which meant that it was difficult for him to engage with the class. And now he's got glasses. It's made all of the difference. And I would like you to prioritise eye health, the simplest thing seemingly, but one that makes a massive difference to millions of people around the world. But I can tell you lot are all eye health experts and I'm not.
Well, sometimes you need a non-eye health expert to make that case to another non-eye health expert. So that was perfect. Thank you, Kate. And lots of people posting in the chat. I think lots of messages around collaboration, which is great, and also government ownership, which I think is something which Stanley really touched upon, and linking it to various other sectors across development, inspiration and awareness. So really great to see all of that come through. So I think that brings our panel to a close. I'd like to thank all of our speakers and our panelists for all their advice and insights today. It's been fantastic and a really rich discussion. Our next session of Advocacy to Action is on Tuesday, the 3rd of August, and it will look at strategies and tactics. And all the information and the materials for this next session is available on our website. I'd like to thank our amazing sponsors of this session and the whole series. They have been absolutely fantastic. And thank you again to all of our speakers and our wonderful audience.